Hello, my name is Erin. I am a family nurse practitioner student. I have my patient here. She is presenting in my office today, complaining of a headache, throbbing in nature, severity 4 out of 10 on the pain scale. She is also complaining of bilateral leg edema. She does have an occupation that requires her to stand a lot. As far as lifestyle changes, she has told me she has gained 10 pounds in the last month, and she does eat out quite often, typically fast food. Both the headache and the edema have been unresolved for the last month since she came to my office, and to which I will now do a cardiovascular and peripheral vascular exam. The first thing I will do is assess the jugular venous pressure and jugular venous distension. I'll have my patient turn her head to the left. When she does that, I'm looking for the external jugular vein, in which it's located here. You cannot see the internal jugular vein, but you can see the pulsation from it. Hers is located right here in the suprasternal notch. I can see a slight pulsation from that. So I have two tools with me. I have both a straight edge and a ruler. I will grab both of those. I will measure the jugular venous pressure by using the straight edge, going straight out from the top of the pulsation, and using my ruler and measuring up. Anything less than 3 centimeters would be a normal finding. My patient here, she is presenting just right at 2 centimeters. So there's no abnormalities found with that. I'll have my patient turn her head straight. I will now assess the carotid arteries. First, I'll just inspect it, looking for pulsations on either side, and then I will go to palpate it. You can palpate higher or lower. I can see hers a little bit better lower. When I palpate, I will ensure I do not palpate both sides simultaneously to ensure I don't cut off blood flow, but I do want to feel both sides just to make sure they are equal, in which hers are. From here, I will also, after I palpate, auscultate both with the diaphragm and the bell of my stethoscope, just assessing for any thrills or abnormalities in blood flow. Just to hear a little better, I'll ask my patient just to hold her breath for just a second. Good. Good. And you can breathe out. And then I'll do the same with the bell. Good. And that's just to ensure that any breath sounds don't get in the way as far as auscultation. Moving on, I will go down to the chest area. I'm inspecting the chest for making sure it's symmetrical, any pulsations, anything abnormal that I see in which I do not. So I will go on and palpate. I am palpating the 5 areas of the heart: the aortic, the pulmonic, the herbs, tricuspid, and my mitral points. I'm going to start on the right side, the second intercostal space at the aortic. Going over to the left side, second intercostal space for the pulmonic. Down to the third for herbs. Fourth for tricuspid. And if you don't mind just lifting up your breast tissue a little bit, I'm going to feel her mitral and the fifth intercostal mid-clavicular line. At this point, I'm also going to palpate for the point of maximal impulse, in which it is very strong and apparent in her. If you cannot feel it due to musculature, breast size, or obesity, you can always have your patient turn to the left side, push that pulse close to the chest wall, and that's just easier to palpate. When I'm palpating for any thrills, heaves, lifts, any abnormalities, in which I did not feel any. So now I will move on to auscultation. I'll auscultate the same 5 points at the right, second intercalavicular space, move on to the left side, go to the second, third, fourth, and fifth intercostal space. I'll listen again with both the bell and the diaphragm, starting with the diaphragm. If you can watch the first issue, okay? Repeating with the bell. So I'm listening for normal S1, S2, anything abnormal S3 or 4, murmurs or splits, in which I heard none. So at this point, I'm going to have my patient just sit up for me, and I will again listen to the 5 heart sounds, both with the bell and the diaphragm. And lastly, I'm going to have my patient lean forward and repeat the same process. Leaning forward would have me hear if she had any aortic insufficiency murmurs, in which I do not. So that completes my cardiovascular exam. I will now move on to my peripheral vascular. With that, I will first inspect the abdomen, again looking for any pulsations or abnormalities. And sometimes you can see the aortic pulsation, sometimes you cannot, but you should be able to certainly palpate it. So what I will do first is actually auscultate it first, right above the umbilicus, both with the diaphragm and the bell of my stethoscope. I will then palpate. I'm going to palpate the same aortic pulsation. At this point, I can also try and palpate both the iliac, the renal, and the femoral arteries. And I will do the aortic with one hand. And then as far as the renal and iliac, I will do it bilaterally, making sure there's no abnormalities. Just for the sake of this assessment, I will have my patient remain clothed, but if it were a real case scenario, I would just have her undress just a little bit, just to feel those femoral arteries a little better than what you get typically through the jeans. And then I will go back and actually auscultate again the femoral arteries. And hear them a little better. Again, ensuring I'm doing both sides, listening with both the bell and the diaphragm on my stethoscope. Good. And I have no abnormalities with that. Going on into the upper extremities, I'm looking for any abnormal colors, any skin issues. I'm going to feel for warmth, making sure they're equal bilaterally, in which they are. I will now assess the pulses, both the radial pulse on both sides, and then the brachioradialis pulse on both sides. Again, just checking to make sure that they're equal bilaterally, in which they are. The last thing I'll do on the upper extremity is check capillary refill, looking at her fingertips, looking for any discoloration, cyanosis, in which I don't see any. I'll push the pad of her fingertip until it blanches and ensure the color comes back within a couple seconds, in which they do. So there's no abnormal cap refills as far as that. Moving on into the lower extremities, I'm going to look at both of her legs, again assessing color, making sure it's normal for ethnicity. I'll roll her pants up just a little bit, just to assess for warmth, making sure they're equal bilaterally, in which they are. I'm also going to look at edema at this point, in which she is presenting with a little bit of edema, both ankle and pedal. I'll assess for any pitting edema, which it does not seem to be pitting at this time. I'll also look at the hair distribution on her feet. Actually, the hair on your toes does help determine the vasculature sometimes of the body. I'm also now going to go on to palpation. I'm going to palpate 3 different pulses: the popliteal pulse, the dorsalis pedis pulse, and then the posterior tibialis pulse. To do the popliteal, I'm going to ask my patient to flex her knee. I'll put both my hands behind her knee, touching at first, and then moving outwards until I feel that pulse. I'll do the same on both the left and the right. I will now feel the posterior tibialis pulse. Sure, doing them at the same time, just making sure they are equal bilaterally. And again, for the pedal pulse, in which they are. The last thing I will do as far as vasculature is, again, do the cap refill. Just touching the both big toes, making sure they blanch, having the color come back in a few seconds. The last thing I will say is, or will check, is because she was complaining of edema on the lower legs, I'm going to assess the Homan sign. That will help determine the risk of a patient if she has a possible DVT. To do that, it's very simple. I will flex my patient's foot backwards and then palpate the back of her calf. Any tenderness or pain with that? Okay, I'll do it again on both sides. And that just ensures we have a little bit less risk of a DVT. If there is any tenderness, we can also do further testing to evaluate that. That concludes both my cardiovascular and peripheral vascular exams. I thank you for watching, and I hope you enjoyed.